Good morning, everyone. Happy that you guys are joining Signal and Symptoms podcast. We have an amazing guest today, Dr. Khayat, and she's going to be talking about with us what we always been discussing and the beautiful word called apply. Again, there's always our intention that we want to make sure that we remove the noise, and that is why this is called Signal and Symptoms podcast. And symptoms takes us back to the patient itself. I'm going to go ahead and let Dr. Zayna Khayat introduce herself. I'm just going to give 2 cents. I mean, she is an amazing person. She has actually done so many things. As a matter of fact, if you go to their website, you're going to see that she has done so many gigs. She's currently been involved with so many people in terms of CVS, Philips. And then right now she is part of, we're AMS. As the principal for that. So I'm Dr. Khayat, there it is, Chief Program Officer for Advancing Innovative Healthcare with Connected Core. She has been associated with Deloitte, Teladoc. Again, thank you so much to Dr. Khayat for joining us. And then I would let you introduce yourself first so that I'm not going to butcher it, and then we'll start chatting.
Right. Good morning, afternoon. Hello, guys. Great to spend time with you. That was an amazing overview, Janine. I got to do this every week and get my state of the state. I think I only read 3 of those articles in the last. So just quick background. I'm an applied health futurist. I don't pontificate about the future. I don't predict about the future. I keep a working picture based on all these trends and signals, not just technology. There's a lot also going in other domains of society that are going to affect the future of health. And to guide people, organizations, health systems on making much smarter bets today that are at least consistent with the future that's unfolding. And hopefully for some more pioneering people and organizations, the bets they're going to make today will shape the future they want. That's what an applied health futurist does.
Amazing. Thank you so much. Beautifully done. I'll open it up to Harvey and Ed to start the discussion and then go from there. Ed, go ahead.
No, it's super exciting. And yeah, amazing background. Thank you for joining us. Yeah. Where do you see us sort of, I know you're not predicting the future. We're not asking that, but kind of like, what have you seen in the last couple of years that gets you excited about what might happen with healthcare, given all progress with AI?
Yeah. I think for sure, some shifts towards the future have been underway for a while. Harvey, you talk about a lot of them. I do. And they've been moving at, let's call it a glacial pace in general, everywhere. Of course, in some jurisdictions, like it's already standard of care. Some of the things that in other jurisdictions, they're still stuck in the past. Maybe for certain populations, we're already there. So there's a de-averaging of these shifts to the future around, of course, not just proactive, but predictive, around care anywhere versus facility-based care, around much more intelligent, precise kind of N of 1 versus segment of 1, much more continuous versus intermittent, much more driven by patients and their families versus, the cognitive training of the most responsible clinician. And then the shift to we can actually start to pay for the results instead of the inputs. So that's the future of health in a nutshell.
Well said. And then I have a question for you. Great to see you again. In general, the tide changes all the time, and and our goals of what we're saying out there changes as well. For me, I'm really pushing, because it's like a bell curve when we speak to people. Some people are early adopters, some are late, and so it's kind of hard to talk to everybody. So, out of your top topics, what are some themes that you're really out there saying, "Hey, I'm talking about X"? I'm just curious what. Because when I heard you speak in Dubai, I loved your talk, by the way. So
that was like the whole future of health in Dubai in 20 minutes. That's my signature talk. I'm sure you have one too, Harvey. People kind of want to just make sense of all the shifts, all the trends, all the signals, just put it together so they can see. So that's my working narrative. And, I kind of just summarized it now. But I'd say the new thing that I'm finding is in high demand. So if I'd say I do 10 or 15 workshops, keynotes, whatever, a week, probably half have to have a theme of AI. There's no question, which is like a year ago, and it wasn't even like that. But then more and more, I'd say almost all of them are about futurism. So they don't really want to know the what. You can read that it's not that hard, or there's a conference every minute of the day. It's more the how do I reorganize myself for the future? So just a couple quotes, and I put some of these on my LinkedIn yesterday, and I got like some of my highest impressions. I'm like, I got to do this more often. I reposted what I think an interventional radiologist named Dr. Sebastian Moffeld. I don't know him. I don't know if you guys know him, but he posted a great thing. He said, we practice with yesterday's evidence on today's patient for tomorrow's outcome. So he's kind of lamenting about this time cycle disparity. And then, in our work, the past teaches, the present tests, and the future reveals what we got right. And so it's like, that's kind of what I'm finding is in demand. This need to understand what multiple futures may unfold in my specific domain, my context, whoever I am.
So beautifully said. So I resonate with exactly what it is. So my problem, I am actually a founder. So the whole idea is to apply. So I met with an amazing group of GI physicians. I'm just going to be very simple. Getting all of these C-suite people to get together to meet with me took 2 months.
Yeah.
Just that meeting. I mean, everything is done. Like there are 15 providers have piloted it. Everything is done. Everyone's ready. So like, can we please get this? And there's a huge amount of pressure, but the organizations doesn't seem to be, moving at this stupid glacial pace. And how do we communicate this extremely important transition? And the transition was from paper charts to digital charts, which is the digital transformation. And they're moving from digital charts to AI charts, which is AI transformation. So you said one of the key phrases is that the patient is also going to be a very key
huge
pusher of this. So can you explore on both these problems? How do healthcare organizations improve a process, and how do patients actually improve the process in getting these done?
Yeah. Couple of things. So I did do sales in health tech. So I wanted to know what that's like to understand, because I was the buyer. I was that Glacial, molasses, C-suite in home care of all areas. And this is what I realized. If you're truly doing entrepreneurship, that is making something new that the world's never seen before, that should unlock new value, which in my view should be the only thing we do when we're doing startups and tech versus all the Me Too's. By default, you're creating a market that doesn't exist. So you need to not only do amazing at your product, Junaid, but you need to write the AI policy, do all the plumbing of all the technology, educate the staff, because that infrastructure doesn't exist and we have a massive technical debt. So I think just give yourself some grace that is the market. And you're going to, as you know, certain customers have that infrastructure. Then the second point I'd make is maybe another customer of yours went through a workshop with Zayna on Futurism, has decided that what I find normally with the C-suite I work with and their board of directors, because we don't do it without the board, because ultimately they're the boss or the CEO, they take a point of view of what % of the choices they're going to make today, whether that's their strategic plan, their operating plan, whatever, what % do they want it to be anchored in the future that they want versus today? All the problems of today, wait lists, And so if your other client did that work and already knew their point of view on what they want the GI experience to be in the 21st century, you'd have no problem. So to me, that's the answer in terms of when you're out there with your different customers, understanding, is that C-suite, are you already helping them achieve the vision that they've all agreed that they want? And if they haven't done that future visioning, it's going to be really, really hard.
Perfect. And I want you to explore this with I love Ed because he's actually ex-CIO of Cleveland Clinic. He's in multiple boards, FYI, if you don't know. Ed, do you want to expand from your experience on that and then bring back the patient advocacy? How do I explore patient advocacy for AI? However, the product is for clinicians.
Yeah, I've taken copious notes here on the side because Zayna is a rock star, hitting all these really key points for everyone. And she's right about the fact that when we're coming with new solutions, and especially in the brave new world of AI, no one has policies, no one has governance, all that kind of stuff. So if you come with a package for them, you can really help them be successful. And I always tell people that, like, the vendors, partners that I loved the most as I was, in a variety of roles as a CIO, were the ones that helped me and shaped me who I am today, because I was clueless. And so if I go back, 20, I'm still a little bit clueless. I'm always learning. But like 20 some years ago, I remember I was given a task. I had no idea. It was a partner, a vendor that came and taught me these basic things that I didn't know and made me look really good. And it could be the same thing, right? You have this AI product that's going to change the world. It's going to, help patients, going to help the clinician. And we get, befuddled because we have all these obstacles because, right, we don't have policy, we don't have governments, whatever. But if you came and said, look, here is a set of, practices that we've seen work in other organizations, that will help them look good, and they'll take that forward, and hopefully that'll speed up the blockades that we all experience, especially when it comes to innovation. So I think that was a really, really good point, and something that people should really embrace and take to heart. The whole thing about, empowering the patients, and that's the big difference, right? I run into it, ironically, it's and I understand why, and I'm not picking on physicians, because I love physicians. I love all of you.
So another quick story, and I want your opinion. So Israel, Korea are the highest ChatGPT users and the highest Claude users. Not for just healthcare, right? In general, the population itself, not to mention the internet speed is the highest in the world. So just understanding sort of the baseline. And now and same thing, Dubai infrastructure is very different. The second thing is, of course, I want to ask you is that the whole healthcare economics works through the health government, right? Like 70%, even in Saudi, MENA, Qatar, etc., you're going to see that it is a national healthcare system. And then, of course, alignment, it can be either great, like, as she suggested, if the whole country is moving towards AI in general, which is the MENA region, massive, explosive investment going into it. I get calls from Saudi all the time. I just don't know how to find a partner. But what I'm saying is that what you're looking at is essentially, how do you square the circle that I can't make sense of it, because the whole population is being provided care essentially through national health care. However, still, AI concierge medicine is going to be going into these countries, in my opinion, unless you advise me better. So how do you square the circle when economics are different from a public as compared to AI, healthcare, tourism? I think that's the word we should use.
Yeah, I'll throw another country at you. And of course, think about most of these countries, with the exception of China that was just mentioned, are smaller countries and a little bit easier to kind of do like something big on a national scale. But I just returned from Bermuda, and that they're very aggressively pursuing, and it's small, right? 62,000 citizens. So it's a little bit easier than 375 million or what have you. And I was talking also with CIO for the Swiss medical system as well, and we were talking about this specifically, like how even though there is socialism, sort of like enterprise in Switzerland, there's enterprise medical healthcare, but there's still a lot of private, like we find in many countries. And so when he modeled what we're talking about, this concierge AI concept, they would be bankrupt. And so would most health systems here in the United States if we said, oh, look, primary care will be pretty much dissolved the way we know it today, and so forth. So how do we make the economics work? Obviously, if we did value-based care, if you were in VBC type of arrangements, this would be sort of a no-brainer, but we know how that works. It's not, enterprise, and it's very selective and all that kind of stuff. So what I'm recommending is that you adopt a hybrid approach. So hospitals should be aware that if they don't move this direction, someone else will, and it could be from outside the country. It could be someone very entrepreneurial like yourselves inside the country, but the patients are going to move there. I'm ready. You all know my story already. I've already moved there on my own. I don't even need, I just made it happen on my own. So I think people can do it on their own, but I think there's an opportunity now for healthcare systems to say, yes, this is going to happen. We can't hold this one back. It's going to happen anyways.
there was a great post, a GP in the US, I forget his name, posted that I've been kind of playing around with. And Harvey, I actually wanted that to be the topic of today was let's play with some what if scenarios of 2035. And his what if, and he, again, as a futurist, you can put the building blocks and see a scenario where this plays out. Yeah, that traditional family doctor-based primary care, it goes away because of what you said, the combination of physician extenders, nurse practitioners, nurses, physiotherapists, chiropractors, and of course, pharmacists, plus patients being the CEO of their own healthcare 80% of the time, plus AI. Is there even a role for this, 5 or 10-year trained, highly knowledge-based specialist in family medicine, if you will? There's a path where not. And then you would take all your specialists, which at the end of the day, every specialist was based on knowledge and expertise. That's now just been commoditized. So you can just start to see how both of those professions, there's a scenario where they could collapse. However, what the other side is actually no.
She's scaring the shit out of me today.
Again, but you have to have a talk about these things.
Exactly.
That's what we do in futurism. So in futurism, because we're just playing with stories. We create a scenario of a collapse scenario. If every possible trend that's negative for your community happens, what does the world look like? We play it out. I use a lot of speculative fiction, design fiction. Biologically, when you hear that, Junaid, what I just said, something in your neurocircuitry changes, right?
Mm-hmm.
And then you might make a different choice today because of that. That's all we do.
All right. So amazing session. Thank you so much for everyone for coming. And I do want to say this. There's a huge need in our world for better health. If there wasn't such a big need, if our system wasn't where it is today, we wouldn't be having this discussion today. And because of that, my other phrase is, we don't know what we don't know. And to Ed's point, he had a problem and he knows AI and he knows that AI can bring in some solutions. And my worry is if we don't address this issue from a global perspective, people are going to start having some outliers or creating some situations where they may actually get hurt. So collectively, let's enjoy these conversations. Let's talk to our leaders. Let's change the rules. Let's create a culture that we talked about that will improve and promote what we're talking about today. So with that, please join us on the next episode. I would love to have you again. And thank you so much for your time, everybody.